NRI on Health Tonight continues with an eye on your thigh. A look at a new way to mold those problem areas to get you more shapely. It's called liposculpture, and only a few doctors do the procedure. One of them is now in Miami. A word of warning, if you have a weak stomach, we're taking you into surgery to see this new sculpting technique up close.
It feels numb, that's right.
Dr. Stephen Baker compares himself to an artist. He sculpts the body, creating continuous curves and smooth shapes with his delicate instruments and attention to detail. The procedure he learned in Italy is called liposculpture, and it's exactly what this woman, we'll call her Jill, was looking for when an accident left her with a large, unsightly lump on her left thigh. Jill considered liposuction first, the traditional way to simply suck away fat, but was worried that would leave an indentation in her thigh.
Dr. Baker's procedure was more of body sculpting, and he was more concerned, as I was, with making both sides even.
With instruments 1/5 the size of traditional liposuction tools, Dr. Baker works on the superficial layer of fat. He removes and redistributes fat and tissue using a syringe.
It's a controlled removal of fat in areas where there's access, with the idea to create contours and shapes.
Instead of indentations and bulges, Dr. Baker says the skin adapts to this superficial fat contouring to create a smoother appearance.
This is not a weight loss procedure. This is not a method to lose 50 pounds. This is what you're trying to create are shapes.
It's a long and tedious process. Jill was in surgery 7 hours.
But I didn't feel any pain, and after the surgery, I was up right away.
And back to work 2 weeks later. 2 months later, Jill is wearing form-fitting clothes and bathing suits she'd put away after the accident.
And I'm back wearing clothes that I wore before. I feel much better about myself. I would recommend it to anybody that, had things on their body that didn't please them. I mean, it's a great thing.
Because this liposculpture takes more time and special training to do, the cost of the procedure is more expensive than traditional liposuction, which can cost several $1,000s. In the year he's been here, Dr. Baker has operated on 30 patients, including a 50-year-old woman and even one man. And see, the great thing about this is it can be used on people who are a little bit older because the skin adapts, whereas with the traditional liposuction, the skin couldn't do it. Everything was done too deep.
Well, I had my eyes closed through much of that.
So you don't even know what the heck I'm talking about, do you?